So we'll talk about two types of surgeries, and these surgeries are usually done around the mouth. So you could say, I came across this when I was reading about facial anatomy. So this is bilateral sagittal split osteotomy. Then we also have the genioplasty. So both of these surgeries we get to talk about, how they are done. So the first one is, we're going one by one. Do you understand? So just so you know, those two surgeries are what? Orthognathic surgery. So you could say they are jaw surgeries done on the jaw. Okay, so they are done to actually correct all those deformities of the face and jaws, and often both functional and also aesthetic reasons. Then we also have the so the first one, we have the bilateral sagittal split osteotomy. So it's a surgical technique and is used to reposition the mandible, that's the lower jaw. They will rearrange it. Procedure, the surgeon makes cuts along the mandible on both sides. So both sides. Are you following? The bones are split sagittally, that's front to back, to allow controlled movement. So the jaw is repositioned. It can be moved forward or backward or rotated. It depends on the jaw issue you're trying to look at. Do you understand? So fixation with plates and screws, basically to stabilize the new position. Okay. Right. So indications: mandibular prognathism or mandibular retrognathism. So it could be that the lower jaw is too forward or is too backward. Do you understand? So it's leading to what? There's no alignment between the upper jaw and the lower jaw. So it improves how you can be able to eat and chew and bite, enhances how your face will look like, and can also improve airways. Then we have genioplasty, which is this, so this one too is all about repairing the chin. So you could see that before the girl's chin was kind of like retracted, but now it has been rearranged. So it's a surgery that is done to reshape or reposition the chin. And types, we have the advancement genioplasty, which is moving forward. We have the reduction genioplasty, which is like moving backward. Then we have the vertical lengthening and shortening. Then we have the asymmetric correction. Okay, so we'll get to talk about the types in our next lecture. So procedures in general: the cuts in chin bone and the bone segments are repositioned depending on your results you want to achieve, and sometimes implants are used. For this woman, I don't want to judge, but it looks more like implants. Okay, so indications: if you have a chin that is receding, or if you have a prominent chin, that's macrogenia, or facial asymmetry in general, you use this. Okay, and sometimes cosmetic enhancement. Some people don't really have much more issues, but they just want to look this way, so they do this type of surgeries.